We have to worry about polio again. The polio virus, which can cause paralysis, has been found 116 times in London wastewater since February and now in the US too. Polio feels like it's from a forgotten era. It used to be one of the most feared childhood diseases, and the wards used to be filled with these tomb-like iron lungs to help patients breathe. Because of vaccination, the disease has almost been wiped off the face of the planet, except a couple of countries where it's still endemic. What's happening in the US and the UK is slightly weird because the last natural case of polio in the UK was in 1984. The samples detected are linked to polio vaccines used in other countries. Some parts of the world that deal with polio outbreaks use the oral polio vaccine, which is safe but uses a live, weakened form of polio virus. Cheap, easy to give, and gives great immunity, but it works by causing a stomach infection, so it's present in the feces. This means it can spread to others, fecal-oral transmission. This is known as vaccine-derived poliovirus. But for the last 2 decades, the US and the UK have just used polio injections, so what's the deal? The stuff we're seeing in wastewaters is virus that's come from using the oral vaccine in other countries. The risks for the vaccinated are minuscule, but for the unvaccinated, depending on the age, the risk of paralysis could be between 1 in 100 to 1 in 1,000. Overall, the vaccination rates in the US and the UK are high, but there are still pockets where too few have had the vaccine, and that might explain why the virus is spreading.